What is secondary infertility? How is it different from primary infertility?
Suppose a couple have already had a pregnancy and they've gone through that, and then when they want to conceive again, and they expect it to be quite instant because they've had a pregnancy quite smoothly the first time. So when a couple is planning for a pregnancy and they waited for 6 months with no other obvious problems and they've still not conceived, we label it as secondary infertility.
When you start evaluating secondary infertility, what are the most common causes that you see?
So there are 3 factors we usually check. We check the uterine factor, we check the ovarian factor, then we check the tubal factor.
When you hear fertility, you just focus on women. But how does age affect males if it does?
Suppose a lady is coming at the age of 35. We know that there's going to be an age-related factor. But for a male, it usually happens after the age of 45. Instead of going to the astrologer to check like whether both are matching, you just come for a pre-marital counselling to see whether you will match. Because there are so many genetic conditions can also be inherited.
Welcome back to the Pluro Podcast, where we bring you honest conversations around women's health and fertility. Conversations that are rooted in science, guided by empathy, and easy to navigate even when the topics feel overwhelming. I'm joined with Dr. Charmila, an obstetrician, gynecologist, and fertility specialist with over 27 years of clinical experience. As the director of Aditi Hospital and Parthavi Ayyavu Fertility Center in Trichy, she has supported thousands of women through high-risk pregnancies, fertility treatments, including IVF, and complex reproductive challenges. What truly defines Dr. Charmila is her belief that women need more than treatment. They need reassurance, clarity, and to be genuinely heard. Through her association with Pluro, she continues to champion transparent, compassionate, and patient-centered fertility care. When we talk about infertility, the conversation often assumes it's about trying to conceive for the first time. But for many couples, the struggle begins after they've already experienced pregnancy or parenthood. And that's where secondary infertility comes in. It's a topic that's rarely spoken about openly, often misunderstood, and emotionally complex, in ways we don't always acknowledge. And so as that sets the stage, my first question, Dr. Charmila, is to just start off with the basics. Because even the term itself can be confusing. What is secondary infertility? How is it different from primary infertility? And there's this very common belief that if you've naturally conceived for the first time, for the second time it should be an easy go with no issues. And why is this assumption misleading?
Suppose a couple have already had a pregnancy and they've gone through that. And then when they want to conceive again, and they expect it to be quite instant because they've had a pregnancy quite smoothly the first time. So when a couple is planning for a pregnancy and they waited for 6 months with no other obvious problems and they've still not conceived, we label it as secondary infertility.
Okay.
And it is not always smooth because many times nowadays we have got mothers who conceive later in the ages. So when they want go for a second pregnancy, they're still older. So they've got more problems now, and they've got many metabolic issues also which comes with the picture. And many times we forget the male factor. The male factor is also a problem when it happens as a secondary infertility, because when you have one pregnancy earlier on, it means the uterus, the reproductive system has worked quite well.
Yeah.
And they've had a pregnancy. It may not be a live birth, but still there was a pregnancy. So the second time, when it happens, we have to check the male factor also. So many times we always concentrate on the lady and we forget the man. So that way, secondary infertility needs a little more nuances to bring out the problem. And when you do it correctly, it's usually going to be a success also. It's not all, because one pregnancy which has happened is going to give a much better result in the second time when they're pregnant.
Exactly. No, thank you. And I'm so glad that you brought up the male fertility already. I'm going to get into that question because, as you mentioned, it's often overlooked. And it's just that this is also something very difficult then for couples to understand. It's like if the first pregnancy, like you said, was uncomplicated, natural, suddenly for it to become difficult again can be a very overwhelming experience. What changes between pregnancies, whether biological or medical, that people often don't realize?
It can be biological, it can be medical, and it can also be a psychological issue.
Okay.
Because nowadays it's like too much of stress is there, because initially when a couple comes for a consultation and we talk to them, they accept it quite freely. But nowadays, there's too much of extraneous information, I would say, from social media. They would have gone through YouTube video, they've gone through some Google News, and they get to that idea like this is going to be difficult and all that. That also adds, that stress also adds, because you have to remember that the reproductive system is totally under the control of the brain.
Yeah.
So whatever happens as a stress factor is going to affect here also. So that's why the first counseling is very, very important. So we sit down, make sure that the couple come, because only when the lady comes, usually the information is not disseminated correctly. So we usually call the couple, we make them sit, and the counseling will start from the first, like what all problems they had. And it can be a biological issue, but still you have to first talk out the history part.
Yeah.
And then when you go for the examination and do the appropriate test, most of the time you can get to the crunch of the problem. And they can give a remedy also. And many times it's quite simple. And rarely, I would say, sometimes the treatment which was done in the earlier this thing could have affected now also. So you need to know the treatment history also before you go ahead. And when you do it in a proper protocol and algorithm, it usually works out.
Yeah. No, that's so interesting. And it's like fertility isn't a fixed state. And I like that you mentioned that it's about bringing the couple in together and working on their psychological needs also, because sometimes you just need to be told or reassured about the situation.
Many times reassurance works.
Yeah, exactly.
They don't even need a treatment, just reassurance.
Yeah.
They wouldn't have actually realized, like both will be working in different places. They will not even know when the fertility time is also there.
Yeah.
So when you sit down and talk with them, many times that usually works. And even if it doesn't work, they will go with an open mind for management. And when your stress goes off, the results are quite.
When you start evaluating secondary infertility, what are the most common causes that you see?
Usually we start with the basic investigation. So that will be an ultrasound. So the problems usually will happen only at the tubal level, as far as a lady is concerned. So there are 3 factors we usually check. We check the uterine factor, we check the ovarian factor, then we check the tubal factor. So the uterine factor you can check out with an ultrasound usually. For the ovarian factor, history is more than enough. She's having regular menstrual cycles. It means her ovarian function is doing quite well. The third is a tubal factor. So a person, depending on her age, then her factors come into the picture. Suppose she is young, below the age of 30 or something, we usually check the ovarian and the uterine and find out whether everything is fine. Then we usually start with a minimal treatment, like an ovulation induction. And then if she does not conceive, we go to the tubal factor. Because tubal factor needs an investigation procedure where there will be little pain if it's done with a hysterosalpingogram, or if you do a laparoscopy, it will need anesthesia. So usually we rule out the other causes, but the commonest reason why a lady was conceived earlier doesn't conceive in the second time will be usually a tubal factor.
Okay.
That we need to check always, and we always check the male factor also. A semen analysis we do, because sometimes there can be a subtle abnormality which has happened after the first pregnancy, and that is what is contributing to the secondary couple. So a male factor testing with the tubal test should cover most of the problems.
Okay, that's actually comforting to hear that it's not like you're going into the dark with something like this. There is a very clear procedure with it. I'm glad you brought up the male, because that's my next question, which is that, age is something that's constantly spoken about in fertility conversations. How significant is it also in secondary infertility? And we often, I think, just when you hear fertility, you just focus on women. But how does age affect males if it does?
Yeah, suppose a lady is coming at the age of 35. We know that there's going to be an age-related factor. But for a male, it usually happens after the age of 45.
Okay.
It's not so early. But when stress is added, and suppose they are in an occupation where there's too much of heat, or the exposure to chemicals are there, the male factor is much quicker to cause a problem. And that's why we always get a history from the male partner, and then go ahead with the investigations. But the semen analysis is very simple to do. It doesn't have much of a big investigation or something like that. But that gives you a basic idea of actually what's going wrong. And age is definitely important for both the male and the female, and the males also, because many times we just ignore the male factor.
Yeah.
But you have to evaluate, and then you'll get an idea what's happening. But age will affect as well as the weight of the couple.
Yeah.
As they become older, they become more obese.
Okay.
So obesity plays a big part in the male factor also. So both these we usually evaluate.
Interesting. It's also, I guess, just not just about the years, but everyone has a different biological timeline, and those are things that you can't control. But it's nice that there are simple tests, like you said. You know how you said the semen test is simple. It's fairly simple to understand a much larger cause and then also act so appropriately. So it's comforting to also see how just far we've come in fertility medicine as a whole. There's still a strong belief that fertility issues are largely only a women's responsibility. We've touched on this already. And how are the changes in sperm health over time that couples often overlook? Is it again, like you mentioned, the chemicals?
Usually the occupational hazards.
Yeah, okay.
Because a person who's like, suppose he's a person who drives his bike a long time, like a Swiggy, a worker who works in a like delivery company who needs to travel all the time. Even those things you need to ask. And suppose you can give simple remedies also, like they should, when they come back home, they should have a bath.
Yeah.
So the temperature comes down, because the scrotal temperature has to be like 1 degree lesser than the body temperature.
Got it.
Simple things like that. And suppose he uses, he smokes or uses other drugs, illicit drugs, or many use those hands, the tobacco.
Yeah.
All that will affect the semen factor. And as a young person, it wouldn't have actually had any effect on his body. But as he becomes older, the usage which was done earlier can actually affect, because nicotine can harm in so many ways.
Yeah.
We don't know like how much it's harming. And that's why the occupation of the person definitely matters, both for the male and the female, more so in a male compared to the female partner.
Okay.
And the other thing is the other health issues. Like suppose he becomes a diabetic, doesn't need much of medicine, but still blood sugar is a little on the higher side, blood pressure is a little on the higher side. Little things which it can get overlooked for a person who doesn't want a pregnancy. But somebody who wants a pregnancy, all this will matter. So we have to sit down and talk with the couple always, and usually we'll get an idea somewhere like what's going on.
Yeah, I think the biggest takeaway from that is just that, fertility is shared, it's not gendered, and it's important to see both.
But nowadays couples are accepting. Earlier days, like when we were practicing 20 years old, 20 years ago, the husband never will come for a consultation.
Yeah.
But nowadays they usually come. And
That's comforting,
They also take a part of, they also, like many times it will be the lady who keeps on coming for checkups, and the analysis wouldn't have been done for the male even once. And after like 5-6 years of treatment, then you suddenly see, oh, the male has not been checked, and then you go back. So that it's not happening now, because the couples are quite aware.
So what is the right timeline? Is there a right timeline to consult a doctor?
Nowadays, we consider that the couple should come for a preconception counsel, or even a pre-marital counsel, because there are so many things which can be corrected before they plan a pregnancy. And going into a pregnancy, that's the end point. You cannot change anything once a pregnancy happens, but you can do lots of changes, interventions before they become pregnant, because you have to remember that the oocyte, which becomes an embryo later on, will take 3 months in the human body before it turns into an embryo. So the 3 months time is very crucial as far as the lady is concerned. And for the male, 3 months is very important, because it takes one sperm almost 84 to 86 days to grow into a mature sperm. You've got 3 months time. So always nowadays we actually call them instead of going to the astrologer to check like whether both are matching, you just come for a pre-marital counseling to see whether you will match. Because there are so many genetic conditions can also be inherited. So why don't they check themselves before they actually plan for a pregnancy? So I think this should go much better, because earlier days we didn't have all those tests and all that to identify all the preconception factors. But now there are so many tests to tell like what's actually going on.
No, I mean, and I'll dial down on that and say, what kinds of treatments are actually available for secondary infertility, and how important is it for these treatments to be personalized for person to person, couple to couple?
It should be personalized, because it's not like a single fit will be there for everybody. You have to change yourself. So the evaluation will be based on the couple, and the management should be definitely personalized. It makes it much better and easier also.
No, thank you. We've touched on this, but I'm just going to ask you again, is that from your experience, do changes in daily habits, sleep, diet, stress, exercise, influence fertility outcomes enough? And how do you guide couples to make realistic changes to their lifestyles?
20 years back, we did not have the IT sector be so strong. But nowadays, we have so many couples in the IT sector, and that is changing the way we are thinking about the management, because definitely the sleep pattern, the lifestyle, all that matters as far as a pregnancy is concerned. And I usually say, suppose a person is healthy enough, the pregnancy will happen. If you're not becoming pregnant, remember there is something else going on which you're not identifying. So you have to change before you become pregnant, because God is telling you that there is a problem there, and that's why you're not becoming pregnant by yourself. So there are some subtle issues which are going on. So we have to talk about the stress pattern, lifestyle, and many times when we tell the couple like you change your patterns and they've conceived by themselves. That's happened so many times. So it cannot be taken as one-off. Yeah. So that has to be taken into consideration when we are talking to a couple as far as personalized medicine is concerned.
Yeah. Finally, for all the couples that were listening who may be feeling discouraged or guilty or even struggling with this, what would you want them to know?
See, the pregnancy is not the only endpoint. It has to be something which gives you satisfaction in your life. So plan for a pregnancy, but don't think that is the end point for everything. It is just a journey. So the journey should be done with so much of clarity, and you should understand what's going on. Make those efforts. Just because you are you think you can afford anything, it doesn't work there. That doesn't help at all. So if there's going to be there's a need for a lifestyle change, you have to make it, because there is somebody telling you like there's something going on wrong and you're not managing it, and that's why it's taking such a long time. So with that idea, they get into a journey of planning for a parenthood. It will usually work. But when they go with those negative ideas like I talked to my neighbor, I talked to my friend, this didn't happen, that didn't happen. They are different and you are different. So you have to plan according to what your body is telling you. That's what
I think you've ended our conversation bringing into the first point that you mentioned, which is about the psychological, mental well-being and how important that is. And so when you come in with an open mind and you come to see a fertility specialist, there's so much more that's possible. Yeah. Thank you, Dr. Charmila, for shedding light on a topic that deserves far more understanding and empathy. Secondary infertility may be silent, but it's real. And with the right care, guidance, and timing, it doesn't have to be the end of a journey. To everyone listening, your experience is valid and support is available. As always, we will be back for more conversations that bring clarity, comfort, and confidence to fertility care.